be here and talk about residency. And I finished the residency with the Alpine Integrative Medicine, which is part of INM residency program. And we will talk about why is it important and everything like that. And I'm so happy to see a lot of names that I know about before. So Richie Lee, hello again. That would be very helpful. Okay, so let's start. So I just started my third year in practice, which is I'm very thankful, and I stay at the same location that I finished my residency. For next one, this is one of many ways to access the next future plan after you graduate, right? So I'm glad that you had a lot of presentation that you heard before during the fall. So this one will give you a little more insight in a different aspect of the residency. So hope this will be very helpful for you. And I would love to have a conversation, a lot of dialogue toward any question you have, and I will explain everything that I have in my slides at first, and toward the end, we will have a Q&A. So at first, during my 4 year of the naturopathic medical school, I joined the NMSA during my third year, actually, and then as a chief financial officer, and then that was finished in 2021. So this is a picture of a group that we were together there. And I graduated in 2021 with a 4 year program. During the last 2 years, I kind of in your same shoes, and I expect that most of you may be in your third or fourth year, and if your first or second year, welcome. It's all relevant. And someone who are already out there and want to listen to this again, I think that's going to be very helpful for you to think about residency and what is happening in those sites as well. So during my last 2 years, I added the program Master of Public Health. The reason for that is I love to see the big picture of community health. We know in naturopathic position, we like to do individualized, personalized medicine. For me, I love to educate for the mass in order to make sure people do have the foundation of health in a bigger picture, and then they can come to me. So therefore, they already have established that foundation of health and then have more interest and curiosity of what next for them. So I graduated with the University of Washington in 2021, and that's a 2 year program. So I got matched with the residency at Alpine Integrative Medicine, do a lot of shadowing actually to different sites before I actually know that, okay, this is a place I feel myself to be in. I feel the personality match, the culture is very diverse. And I just reached out to them to shadow for a day and for 20 hours plus requirement for that residency, requirement for the shadowing opportunity in your clinical rotation during your final years of school. So that was part of the Institute of Natural Medicine and finished in 2023, which is the September, October this past month. So the bottom is our picture there. And toward the end of my second year, I received an announcement through the INM, the director who talked about the FAIHM, which is Academy of Integrative Health Medicine. They are from California. They provide a fellowship. It is online. It's like Canva. All courses is online. It's pretty rigorous, I would say, full-time, working here 5 days a week, and also have to contribute about 10 or 15 hours per week to do a fellowship. It's a scholarship for the BIPOC provider, which is helpful for us because I don't have to pay extra money to ask for more loan to cover that. So that's an opportunity that I believe this residency have helped me to move forward with this. All right, and then I got hired on to become an associate physician at the same site. So the agenda today, let's talk about what is a typical 2 year INM residency experience. This is one of the way. There are many other ways to do residency. For example, people can create their own residency by having connection with a site, and you can ask to see if you can work there, and through that working experience, you can become as an official residency. And you can do a lot of like hanging your own shingle when you graduate. You have your license, and then just work. But there's a trade-off in every pathway that you choose. So just stepping in and know what it takes to do the work would be very helpful. Now, number two, what is the benefits of residency? We may have an idea of what that is, but when you really do the residency, there is negative, the pros and cons, for example, and what it would be helpful for you for the future while you're going through the mud of the very thick layer of learning and also training, advanced training after your 4 years of the medical school or 5 year or 6 year, etc. There are challenges and surprise. I will talk about that. And the last one is a useful tip to become a helpful, successful resident in your program. Okay, so let's start it. Let's start with this. So the first things I will talk about the typical 2 years INM residency, clinical duties. So different clinics will have other residency structures, but the basic foundation requirements is similar across the INM sites. So for the next slide, for example, these are laid out for the clinic supervisor, which is the owner of a clinic, to know and for you to see. So there is always a contract to sign and you are clear about what is expected of you. When you come in to talk to the person who hired you on, right? For example, if you're not doing this INM residency or you're doing this, then it had to be something clear. So therefore, you know what is expected of you. And each clinic will specialize or have a focus differently among different clinics. For example, primary care, which is the side I'm doing now. Primary care, we do a lot of hormones, IV therapy, injectable, which I'm not too specialized in. So I'm just like that is some other provider is specialized in, but I'm not learning that aspect. Depend on what you would like to grow in your future potential. Yeah, that can also add them on. So the workload could be 40 to 60 hours, sometimes more, sometimes less in the beginning. It could be a little less because you're learning the ropes. You're learning what they have in the clinic. So therefore, one day you can build that similar structure if you like a structure you're having. As you become more busier, then the 60 hours probably you will get there. Yeah, and then supervision by the primary faculty supervisor. So 16 hours per week, that is a possibility there. And also clinical activities and visit and procedure. Procedure can be minor procedure, how to do wound care, could be IV therapy, blood draw phlebotomy. We have ozone therapy, so we have to learn about that too. And that's roughly about 16 hours. And I highlight these yellow thing is about 8 hours of clerical and administrative work per week. So imagine the residency one day would love you to be on your own, to open your own practice. So therefore, there will be more sites open for residency, if you will. And this will be helpful for learning the logistic. And it will make your work become faster over time when you see more patients. And the counting of 500 primary care patients as a minimum. This is the extraordinary high number, which is great. First year I get around that number. Second year really exceed that number. If you ask other provider who graduated and practice on their own, this number is hard for them to achieve because we have to learn. They have to learn many other aspects. For example, marketing, business, attracting clients, advertising for themselves during that all time. With the residency will allow that you don't have to worry about that yet. Your work is to learn the medicine, deliver the medicine, and get the result that you're looking for. And then the business aspect of work will take care and help you, guide you through that pathway of how to support a patient in the non-clinical side. So next part is a semi-annual symposium as a part of a 2-year INM residency. This is a new number. In my year, it was 4 times per year, but this one they changed to 2 times per year. And it is each seminar is strategically themed according to the progression of developed competencies expected during the residency. So for example, men's health, women's health, endocrinology, urology, neurology. It sounds familiar to what you're learning in school. However, these are the applications that the speaker provided case study, and you also have the experience in a clinic to ask more clinical questions that apply to your practice at work. right? For me, it's very helpful. I love engaging the conversation and asking questions where I feel like, did I ask that question when I was in school? But now I feel like, oh, the patient actually can apply for this, and I can remember who that was. So therefore, I can go back to work and also talk to the patient when they come up for the next visit. There will be residence site rotation. This is phenomenal. I love this part. It can be draining sometimes because you work full time and I just to take their time off from work and go to different location of the A&M and then shadow the provider. So if you don't do these kind of residency, it's gonna be hard for you to know what is successful sites out there, because these sites has been proven themselves successfully economical and also a long established site clinic. So each resident is required to participate in annual clinic site rotation for exposure to various clinics, business models, and mentorship. Business models is a key. So there are 14 clinic sites total. So 10 in Washington, 1 in Oregon, 2 in California, and 1 in Vermont. And the number was what I was told recently, so the number can change over time too. And next is a business learning. This is also big things as well, because in school I attended Hero from an MSA, Blueprint, Success Blueprint, something like that with Dr. L.I. Camp. There's business courses in school incorporated in the curriculum as well. When we are not in that position to make business decision, it's very hard to know how can we apply that. When you are in residency, or if you practice with other provider in other setting of residency, this become more prevalent to you. So as a result of this business learning, the resident will be prepared to play a leadership role in an assistant clinic. What I mean by that is you can take on hosting an event. You can take on a program, for example, supplement inventory, calculating how much money we make for that, or even a program of establishing what kind of packages we sell for the patient and how to track that. And each different clinic, for example, QuickBooks, any type of tracking accountants will allow you to see the progress of over time of the program or the product course itself. And by completing the 2-year program, you will confidently launch your practice using their business building skills. And I think this is subjective as well. Some of us maybe love business, love marketing, love any of those business aspects. And some of us just hate it. It just takes too much time rather to learn medicine and deliver that. So it is a mix, and then at least it's there for us to learn. So therefore we can have a muscle memory in the future to use. So next part, resident evaluations, didactic tracking and recap. It sounds like in school for sure, but we do have that in residency in this program. So what that entails is there will be a system on Excel during this residency to ask us to track how many patients we see, what conditions, what complexity, what age group, what genders, etc. Or do we do any gender affirmative care? And it's also track a clinic business meeting, any grand round, community talk that we did, etc. And the resident will meet quarterly with Bastyr Residency Director, and that was Dr. Garcia. That was what I met. Clinic Site Director, which is Dr. Brooke and Jashar, who is a business owner here at our site, and I&M Residency Director to determine progress and the balance hours of learning and mentorship. So if you see there are so many players in this residency because we want to balance that out. So therefore you are not taken advantage of. Also, you are really doing your work, and the business of the site really say and commit to the requirement from the I&M residency to make sure things are in balance, not one over another commitment. So next, resident community. So there's group orientation in the very beginning. There's a kickoff parties in the beginning to get every resident and site director, alumni, and the sponsors as well. Sponsor meaning any companies out there support the I&M residency to get to know each other. Saturday social events after seminars, and the summer splash social events as well. you will realize how busy we are, and then in order to connect to each other is very hard, and we only connect within the clinic, but when outside the clinic it's going to be a little difficult. My personal experience is that way. And we have 10 different practitioners in our clinic, so we are very diverse, so therefore it's helped me to have like mental health to talk to our colleagues when I have a problem, compared to other sites depend on how many people they have in the clinic as well, right? So now going around with case presentation. As a student final year, you'll probably do well with this. And then that is just a little duty that we have to do with a residency here. So at my clinic, the resident is required to present a short case per month. It could be any case that we got stuck on and needed experienced providers' guidance. It's very helpful when you're starting out. What that means, when we were in the third or fourth year in school, we are under supervision of the attending. A lot of decision will be based on what they think. So the freedom to practice what you think may be limited because of liability and everything like that, right? If the treatment plan jive with them, then that's great. But if it doesn't, then we have to explain of why we're thinking the way that we're thinking. So in real practice, even residency, you take that role of attending on your own some way, like 50% or 60%. You still have to talk the case through with your supervisor when you got stuck. At least for my case, I have a lot of autonomy. When I know what my treatment plan is, I talk to my clinical supervisor often, and then that is a pathway. And because of a pattern, it become easier. And our population is very specific and focused because we do a lot of primary care, which is acute treatment. At the same time, we have hormone management, which I learned. So a lot of women coming in almost for the same condition. So we're kind of learning that and then just twist a little bit of how they feel differently for the case. So that's helpful for me to have that autonomy to do that. So the last but not least is a case report. So collect the data through the labs that you run with a patient, imaging, if you do that too, encounters, and write a professional case report. So I used many skills from my undergrad, and I was major in biochemistry and medical humanity during my undergrad at Bastyr University in Waco. And we wrote a lot of paper, but it's more about benchmark research. And I also use a skill in my public health program to complete this case report. If you are not having that skill, that's completely fine. If you do have a lot of skill, then that's great. There is format provided, so therefore you can follow. And these are more toward clinical case report. And that can help you to begin writing a research article for submission as well. So next part is the benefit of residencies. These are added a little bit of what we talked about earlier. So let's be more specific for this, right? Number one, the residency will increase your clinical confidence in acute and chronic case management, exposure, skills, and structure mentorship. So in terms of mentorship, right, we wish we knew everything about practicing medicine when we graduate from school, but the reality is we are prone to making mistakes and subject ourselves to liability. It sounds heavy. So when you were in school, you have supervisor to ask question. Is that right? Is it wrong? Or should I do this? Should I do that? So in the practice, you almost like heavier burden a little bit. At the same time, with a mentorship of someone, and also our clinic have a diverse expert, like 10 years plus experience provider. So I can go through and ask different questions to different provider, what would they do? And everyone will have different answers. So it takes a lot of discernment to go through. So having a mentor to help you avoid errors and allow you to utilize available resources to ask questions when unsure. And imagine experienced provider or supervisors, they probably in their WAMP board, AANB board, or INM board, these people know what to help you avoid liability when patients try you on something of their legal battles. And that is something we haven't had any training because there need to be experience to really know how to deal with this. In terms of clinical confidence and exposure, in the clinicship, we may share 1 to 6 patients among practitioners and students. So there's not enough time to establish the therapeutic relationship for consistent follow-up. So the residency offers a constant flow of patients from clinical referrals within the clinic, right? Within the clinics, when they know what you do, how confident you are, then they refer your patient to you. So residents can hone their skills, learn from the diverse practice groups, and follow up with patients more often. So when you really do a great work, the patient will refer to friends and families members to you, and you will get more patient contacts that way. So if you practice on your own after graduate, then that's going to be very hard to achieve. And it depends on the size of the clinic. And if they are very busy, then you're more likely to be busy, right? And according to the ANMC Resident Satisfaction Survey in 2023, 92% of past residents reported increased clinical confidence after completing the ND residency. And then for the same survey's data, 80% of past residents shared that the residency positively supported the professional growth. So what that means, professional growth? Residency provides seminars, symposium, and CE event. For example, INM provides free CE through the semi-annual symposium. And there's a discount for the residents in other conferences. If your work is willing to pay for the conferences outside of the residency, then that could be something that you can tap on. So this helps you to learn new applications, but also help network with other integrative practitioners at the local and national levels. So our clinic, every year, they try to ask something new, but at the same time, keep the foundation of the population patient that we serve. For example, anti-aging. We went to FAIHM conference in Vegas last year, and this year I will go as well. WAMP conferences. Dr. Brooke was in a board, and now she off the board, but at least she was supporting that WAMP. And then another provider who is a gastro specialist, so she goes to gastro AMP. And then I got to know to learn how to treat GI symptom as well. So I go into that conference to help. And in that conferences, you will see familiar faces. You will see, wow, expert people. Why am I deserved to be here? Because you're so expert. I don't understand what you're saying. However, that is a gateway for you to build connection, and the more engaged, that will help to pay it forward in the future for you. So don't be afraid. Get out there and do a great work. It will come back in a good way for you. So number 3 is further your postgraduate plan. What do I mean by that? So some of us may hesitate when applying for residency since there's not enough site. That was my fear when I was in your shoes. And you may think about just hang your shingle and practice on your own. And you may get another degree, like what I did, to boost your credentials. And so I decided to shadow many clinics in my last year in school. I wish I could have done it earlier. However, COVID happened. And during that time, most of the clinicship was online. It was very, very difficult to practice things just online because patients now will demand, like, I would love to have my doctor in front of me, see how she's practiced. And you may hear more about functional practitioner, only do online practices, charge a lot of money. It's subjective, right? Everyone wants to make their money and make a living off from it. And everyone would love to not being burned out. My opinion is if you don't get mold, you don't get shaped, you don't get asked difficult questions, how could we overcome that challenges to help the patient if they have a complex cases? Because you will find yourself to talk to lots of specialists, especially for those patients who turn into Medicare, who Medicare doesn't cover ND anymore. And you will be in the place where you have to explain to this person, this patient, like, sorry, if you want to see us, then cash service is what you're going to have to do. And they're on fixed income. So that is difficult conversation you have to explain to the patient, but they will understand as well because that is beyond our scope of practice sometimes. Yeah. So working with the established successful practice will give you ideas of how to start your own in the future. So now number 4, integrate ND principles, pharmaceuticals, nutraceuticals, physical medicine, homeopathy, botanical, etc. So there are so many new drugs and supplements on the market that representatives of these companies constantly approach practitioners to buy their products. Residency and all the knowledge that I gained in school helped me to discern what is best for my patient by um, by combining the learned modalities and what is available in the current practice, right? So in school, there are separate shifts for homeopathy shifts, physical medicine shift, endocrinology and cardiovascular, and people refer out to each other within the clinic, almost the same as real practice. However, there's a little twist. So, but in real life, when you have a patient in front of you, you have choices of apply different modalities ongoing with the same patients. So if they prefer to get everything done in one clinic, that's you have to really set a boundary there, because when they want to have everything done, we have to really state that 1, 2, 3 problem. Maybe we can get some done, but not all of it. In the next visit, I will able to come back to that. The reason the patients always want to go to the one clinic instead is asking for time off work, reschedule their life. They may have childcare, they may have duty and responsibility that is a little obligation and schedule conflict. So, but when you need to refer to a specialist, then please do so. We don't have that skill yet as a resident to really do too high maintenance complex case. And in the future, you will learn that for sure. So residency can fill gaps in naturopathic training and apply real world principles. So 6, oh, actually 5, I can see that, let me move. So number 5, you will see more volume of patients and clinically diverse patients in the first 2 years than would occur starting out on your own. This is really true. So based on the recap didactic training that I did, so in my second year, though, my first year is a little lower number. My second year, I saw 89 patients in Q1, 176 in Q2, around 337 in Q3, and around 333 in Q4. So the last 2 quarters is maxed out. There's no more slot in the schedule. So that's the reason why it was a maxed out number of around 300, 330. So that averaged about 6 to 12 patients per day on the patient care shift. I also have 2 to 3 IV shifts per quarter as well. So I inherited patients from previous doctor and the clinic supervisor because over the years, they trust me with my work ethic and the patient practitioner relationship, knowledge of hormone management and primary care. And I'm grateful to serve such a large population and thanks to the residency experience. Experience is a key when it comes to speaking your credential with the patient, right? And number 6 is the residency open up multiple career paths and meet demands of primary and specialty care. So that include clinical practice, speaking, consulting, and employment in the healthcare world. So professional exposure can lead to the employment. So for example, I was asked to join different clinics during the conferences. For example, the BTL, the one from the M-Scope that I went to about a month ago. After just ask one question in the big audience, it was intimidating, but I think that at least some other provider would see what my view aligned with them, and they just reach out. To be honest, they just reach out, and some people out there is also want to grow their practice, so they kind of know that you are integrative medicine and they want to add you on, things like that. So, and you can be asked to participate in research or volunteer for organizations. So the key is I took consideration of maintaining a work-life balance and if the experience adds skills to the future endeavors. And that's a lot of thinking to think inside whether you're going to take a new task or not. Yeah. Number 7, so residency provides pathway for society board certification, such as board certified in naturopathic endocrinology. There is a FAIHM, which is a fellow by American Board of Naturopathic Oncology, fellow of American Board of Naturopathic Gastroenterology, etc. So I got a scholarship with the fellowship with the AIHM, thanks to the IMC. So that was my one pathway that I want to talk about. And when I attended the headache conference by UW Harborview probably about 2 months ago in September. And they also provided a mini fellowship by the University of Washington to enhance practitioner skills in headache management and when to refer to the specialist. Number 8, the real world business experience versus the academic clinical medicine. So you will learn the business skill from the clinic owners, from supervisor by tracking how many patients you see, how much money you make per visit code, how to incorporate different modalities and tools to make packages. It doesn't sound like what we were taught in school, but this is something in real life to make the successful and sustainable business model. And learn about inventory of a supplement and administrative tasks. So you will get trained on creating, writing, and publishing case studies to enhance that ND evidence base. Number 9 is to broaden into professional relationship. So residency can build in collegial support and relationship with practitioners within the clinic. So residency teach you how to work successfully with MD, DO, nurse practitioner, primary care providers out there, and specialists in the community on behalf of your patient to build a successful career. And last but not least is a CE discount for membership and journal. So CE and malpractice is not cheap. If you haven't getting to know how much money you're gonna spend after you graduate, this is something to start. So these numbers may differ based on where you practice as well. Different state will have different costs and price. So a typical CE event, the continuing education event, that's what I'm talking about, for professional can range from 500 to 800, sometimes can be $1,000 or more. So plus travel and lodging. With the residency, we can get it as a $150 or $300 for an administration fees. And there are some free CE out there that you can try. And I prefer the CE, which focuses on the expertise that I want to be good at. Right? Malpractice insurance for the first year, at least for my case with MIC is around 500, 600 for residents, then jump to 1,500 in the second years and continues to build up annually. So as a residency, you have a discount with WAMP, AMP, Gastro AMP. So that is a big deal because we won't know a lot, but with this continued education, it will help you to hone the skill, what question to ask, and how to watch out for complicated case and red flags. So let's talk about challenges and surprises. Nothing is perfect. When you go shadow, you would love to find some perfect site for you. However, there's always a trade-off. So let's delve into this. Number 1, business models like concierge, packages, and program employee versus independent contractor. I never know about concierge until I joined AIM, which is the Alpine Integrative Medicine. And in school, we only see patient and learn to code 99213, 99215, 414, or new patient 99203 up to 99205, based on the complexity and the time base. So at least when I graduated in Bastyr, there is a billing and coding services. And at work here that we do hire people to do billing and coding as well. So we know that code, but we don't know how much we really get back, right? So in the clinic, we do have a way to track how much we get back. If the patient actually pay the deductible, that's a hard one. Some patient will try their best to justify the services to see if they actually pay what the services provided. And that is a conversation to identify what your work is, you did the work versus what they don't want to pay. That is true in the clinic. And insurance companies can take months to pay for services. I was surprised when I look at some insurance and I wonder, 3 months out, a year out, and they haven't paid us. So how could that happen? And to keep a sustainable business, there must be a creative way to have a predictable fixed amounts coming in monthly from concierge tiers, at least what we do, selling packages like a series of acupuncture, ozone therapy, or combination of modalities upon a condition. Okay, so number 2, many supplement specialty labs companies representative want to sell products. This is overwhelming for me. So when I first started the position and was in charge of ordering supplements, specialty labs, and IV supplies for a short term, the representative from these companies at least coming in at least twice per month at the beginning of the year because they have new product to sell. So this is an amazing opportunity to use my brain to discern what is necessary for my patient and what is ethical when we push one product over another, right? So be ready to ask if they have human data, clinical trial if possible, and any data to prove their efficacy for a certain condition, to see if that actually can be applied for your population at work. So here's a scenario I like to share. So many specialty labs require out-of-pocket costs, and that could be from $95 up to like $300 or $500, right? So do you think it would be medical necessity to order labs from Quest or LabCorp through their insurance before digging deeply into things that we may not have enough data to back it up? And any specialty lab will require certain understanding, CE learning to make sure we understand how to interpret the data correctly. And if they have enough research to back that data up to make sure we can compare with LabCorp or the Quest or any other lab out there. Number 3, transition from flexible school schedule to working 9 to 5. Burns out is a real thing when you have 10 or 12 patients, 3 or 4 days per week. And this is my transition is my first year challenges, the second part burned out in my second year challenges, and continue on until you really learn how to do self-care. And I'm trying to practice, but I think no one really perfect until you keep doing it. So my experience was that I learned the ropes in the first 6 months or so, and know exactly how to apply protocols, modality, nutraceutical, blood draw, IV administration. It's just clean out your skill and techniques, because when patients come to naturopathic doctor office, more of the small business. So the thing we do, they expect to be different from the hospital. They expect to be more, in my opinion, is more higher service, higher standard, more caring, and more direct, and less challenges from billing, right? So you also learn the logistic. I also learned the logistic and hormone management for perimenopause women, which I was not taught in school, and primary care, which is completely fine. There's a lot of new condition out there that specialty or specialized expert will also teach you, and that is how you can hone your skill to get that population if you like that condition. So once a patient see the results of how you treat them, they start referring to friend and family, and you become so busy. And I repeat myself quite often. So for a creative outlet, I continue to grow my social media presence, and put more educational platform to help them prepare questions when they come to see me. And that takes a lot of work. Yeah, but it's helpful one way or another to help patients know you before they come to see you a little bit, right? So liability protection versus patient demand. Think about long-term consequence. This is, you will get this more when you apply your skill and seeing patient in practice. So in school, you're under the supervision of the attending, and the liability falls on them. But in practice, it's on your medical license to discern. So I had an experience with a patient who asked me to sign the Washington medical leave paperwork that was not even from her company, so she could get paid when she quit the job. Usually people coming in to ask for time off from work or change to a part-time or stop working, they probably should have their paper from the workplace, from the employee. But this patient coming with just a Washington medical leave, very big, right? So as a new doctor, I had to really talk things through with other colleagues at work to make sure, is that legal? Is it ethical to do this? What would happen in the future? So if you have a big group practice that support you, then these will be helpful, very helpful. So number 5, money in my pocket versus student loan. Full-time residency has an option for deferment, but the interest rate still accrues. Part-time fellowship doesn't allow deferment. So that what happened to the FAIHM, it doesn't allow the deferment. So I highly recommend discussing the student loan payment with a financial advisor. FAFSA has a income-driven repayment plan that you can lower the payment each month. And during school, I worked 2 or 3 part-time jobs simultaneously during school to cover the rent. Some other stories, my friend has the baby during school. And I would expect some of you, or at least assume some of us out there may already establish family during school, or maybe think about in the future after graduate, or you may change your career from another career to naturopathic medicine, right? So all life happen in different situations, and we just do the best. The residency allows a fixed income no matter what you do, and it increases in the second years as well. So number 6, working in a big group of practice with different personalities and prefer ways of working. Detailed duties and responsibilities sometimes falls on the resident. So my way of dealing with this is keep a positive attitude and practice the boundaries. It is continuing practice I have to learn from different provider too. So as a resident, you will be asked to do lots of logistics, because we do not have, in my clinic, our clinic, we did not have a medical assistant then. Now we do. When the phlebotomist is out for the day, the resident has to jump in and complete the task. When a provider is sick for the day, then the resident will answer the question, the patient's question in the portal, if appropriate. And the whole experience is just to help you to see what it would take to own a clinic in the future. Number 7, no one medicine is superior to another. All medicine has a place depending on the patient's needs. We knew about this a lot, but I think it come out more during the experience of real life. So I always thought that MDs has better answers than MD, because we treat the root cause holistically. However, the AIXM fellowship taught me that other medicine like Ayurveda medicine, Chinese medicine have their ways of healing too. And most MD burns out in the medical system. So they change to seek integrative medicine and also practice integrative medicine. And a good way is to network and learn how to unite and work with them. And number 8, I know I'm gonna leave more time to have Q&A. So let's go through this. So I found myself, I lose connection with old friends after graduation, and some friends quit their job halfway. Like, what happening? Everyone had their life. And then some people move back home. Some people move to different states to practice, and some practice in a non-licensed state. So it's difficult to connect, but it's very helpful to ask to see how other states practicing and how they're doing to help the mental support, the social support, right? Number 9, the patient population is so different from school. Residents may end up taking care of a whole family, and if you are doing a great work, word of mouth is powerful for referral. It also sometimes can kill the reputation. So consistently and persistent strive to do the excellent work is very key. So tips for success. Last year or third year, please proactively shadow different clinics, even though you exceed the amount of hours required. Or if not, then just fill them out with the hours. Ask great questions. Example, how was the culture looks like? What kind of patient population that you see? And then also what condition I usually see, and how would you see, like as a clinic site, right? How would you see the role of the resident fitting into this clinic, and what are you expecting, or what are you looking at in the quality in the residents, and see if you can succeed in that clinic setting. And relationship is key. Number 2, I know that in school we are so exceed with our responsibility. Time in school is overwhelming, right? But I also recommend take as many elective classes, and including business classes, as possible to expand your toolbox. That will help you negotiate your worth and contract when it comes to the time when you graduate from residency, or when you graduate to look for other jobs, and you can just spell out of what you did or what greatness that you do for yourself and for the population. Because when you graduate, you may not have time to return once you graduate, and the cost of these classes for the provider is much expensive than the student. So number 3, commitment to the task. Don't be afraid of taking more patient in the beginning, because the more experience you have, the more year of experience you acquire will add up to your credential. If you hear a 20 to 30 year experienced doctor versus a brand new graduate, or a 3-year experienced doctor, who would you choose, right? That was a very real thing. So now number 4, get good at primary care, including DDX, workup, acute treatments, that will come with chronic treatments later before deciding on a specialty. This is so important. And that is my personal opinion because we will have a common language to speak with other specialists when it comes to a complex cases. If we don't have that common sense with them, and you may hear like this provider is not qualified naturopathic doctor, and they think we are not valid as a profession. I would say that when you work with a big group, or at least have experience to talk to them, pick up the phone, consult about a case to make sure you're doing safe, they are appreciate you because you're doing a safe medicine, right? Now, number 5, apply yourself to a different job: caregiver, teacher assistant, research assistant, student organization, volunteer at different conferences, events. When you volunteer, you can have a free administration, just to let you know. Just ask them to learn how the real world work in the healthcare system. And this is for people who not having this experience in healthcare much, like for me in the past, but I know some of you may have like EMT experience, changing to different jobs. So it's very dependent on the people. And during school, I have a lot of side hustle, and I got hired on later on to become a counselor part-time on my own time while I'm working full-time with AIM. And last but not least, be open-minded and consider the opportunity provided, or even create your own opportunities. Engage in a conversation and play well in a group. Think as if you are the employer while you're the employee. What I mean by that is create your own opportunity. I love educate, empower, and grow with my patient because they are my teacher. Even though I'm not in the age of perimenopause, but I will be one like them, right? So I collaborated with other healthcare providers near this location of Redmond, and we created a free community event 2 weeks ago. It called Perimenopause Roundtable. It was very successful, full room, and there's a lot of referrals coming from that. So that was the last slide, and here is my contact. You are welcome to, if you have any specific question, please reach out. If I don't know how to answer your question, I will definitely try my best to refer to any other residents that also go through this program. Yeah, and feel free to come up and reach out to Shadow. We have different providers here that you may interested, and just search on our website of Integrative Alpine Integrated Medicine. So question.
There was a question in the chat that I think I addressed, but if you can take a look and see if you have anything to add, that would be great.
Let me see. There you go. There were 7. Okay. So it's from Jackie Rayleigh, right? The question, the bit of vulnerable question, my fear is I'll have to pick between starting a family or doing a residency. That is real. Do age where I'm personally in life, can you speak to if residency sites have any experience with maternity leave, if that's allowed, and or can we take a gap year between school and starting residency? That's a very great question. I have another friend in my cohort who started another residency site. She had a baby 1 month, like gave birth to the baby 1 month after she started that residency. I First, I would say when you jive with that residency site, ask them what is their policy. Do they value your life, or they value more patient contact? If they hesitant to value about your life, your situation, I would say, okay, try another one to see if that happens. Because sometimes if you try to mold into something that you're not, that is very hard match. When there's not a good match, it tend to come out not great. So we're trying to prevent that, and we try to make sure your residency is optimal and you learn the most you can during that time, right? Yeah. And second question, when you ask about can you take a gap year between school and starting a residency, I would say definitely. If your baby needs you, if your partner needs you during that time, you can still take and continue education to support yourself, learning more about businesses out there to see what can be done. And when you're ready again for the residency, then come back to these portal A and C. They have like those matching per year. And when, even though you're not getting matched first time, there's a second round of matching. So don't worry about that. And if you, during that gap year, you find, oh, there's a clinic who appreciate who I am, my personality, my knowledge, even though I have my family and my baby, then ask them, hey, can you hire me on to be a new provider under the official residency, and I learn your role to make sure you can borrow their credential in order to have the patient contact through that way. So that can be possible as well. Okay.
I just want to extend on that as well. We actually currently have a resident at INM that took off 3 years after they graduated school to spend time with their family, exactly that. And he's doing well and flourishing, and it was a really great decision for him. So it's definitely possible, and it works out really great so long as it's what you need in your life. Like Dr. Lay was saying, make sure you tune into where your boundaries are and where you want to be, and don't mold yourself to another place, but find a really great match.
Mm-hmm. Next question from Richie Lee. Hello again. Can you talk about compensation and pay? I will refer that to you, and then I can talk about my experience.
Yes. So INM, since we have residency sites all throughout the US, the pay is based on the average income in that area. So it does fluctuate, but we do have sheets that we can help provide. And I know that we really try to match within a certain percentage of Bastyr's residency pay. That's kind of the standard that we go off of. So it's pretty comparable. Um, so INM does have a set amount that you must go above. However, other residency sites that may not be through Bastyr or INM, it's very much so on a case by case basis. So again, that is something that it's important to kind of ask these questions. And that's why shadowing is so important, because you can actually kind of get to know that before you start going into this matching process, and it feels very quick. So definitely reach out and ask each clinic. It's very independent, but just know that both through INM and Bastyr specifically, there are certain amounts that we have as the base.
Yeah, my response pretty vague, but can be specific. So the inflation will incorporate into what you're gonna make next time. In a year, if you show yourself, you prove yourself, then for example, for me, I got a bonus outside of INM residency, right? Because I bring more patient in, doing the thing that they are asking me to do, at least, that helpful for the business. And therefore, the bonus can be it as an incentive. And sometimes there's packages from the machine or the tool that they provided for the program for the patient. And if you consistently bringing that consistent amount of income in the clinic, then potentially bonus can happen. Second year, make more money for sure. And I know when you really do, again, great work, you have a lot of things to spell out that you did this great, you bring this amount of money per year, and you can also know how much money you bring into the clinic. When it comes to contract, when you graduated, if you decide to stay, then you can also negotiate, right? Negotiate. And then I think the skill of negotiation is it is a learned skill. I had to really learn that, because for my personality, I tend to just like take whatever they give me at first, and then think about it without really asking. But I think that when you stand up for yourself, and during practice, the standing for yourself is setting boundary of how you're willing to provide the services, and what you're willing not to do. And that will take time to come to that. Yeah. I would say if you want to reach out offline, then I'm happy to help you with all of that. But I would say when I first started, I tend not to care too much about the amount of money. And I know when you have children, it's important for you, but I didn't have children when I first started. My goal is I want to make sure I learn the right medicine, how to treat with the liability, and to make sure that I'm safe, and the patient is safe. So therefore, one day, if I decided to learn the business and open my own practice, or practice on my own online, for example, in a different way, then I know that I can make money later. But at first, I trade that amount with the knowledge that I accept. And with a residency, you have a fixed income. When you start out on your own, you probably will not make the same amount that they give you. So that is a fact. Yeah.
Yeah. And I would encourage, just like Dr. Lay was saying, think about like everything too that you would be paying if you were going directly into practice. And I think that's a good
Yeah.
comparison as well, because as she mentioned, there are certain discounts you get, as a resident that you wouldn't get as a practitioner. Just, things like potential for bonuses, vacation pay, sick leave, all of those things. If you're an independent practitioner, you don't necessarily have access to all of those items and healthcare and malpractice insurance. And, those things do add up. So I would encourage people to really look closely at what they think their projected expenses and income would be when they're looking at the potential for residencies. Because I know, as Nicole said, sometimes some of the sites can't pay exactly a super high amount, the ones that are kind of outside of the school systems and the INM residencies. The more independent residency sites sometimes are not as comparable. But again, you have to take into account all of those different things as well as the cost of living. And for where the residency site is, that can make a big difference. So
Yeah. Mm-hmm.
So I think, unfortunately, we're at the end of our time, but thank you so much. And thank you for sharing your information. I'm sure that a number of students will reach out to you. And thanks to INM for helping us put this together too, and finding a great candidate who's able to share their experience. So yeah, I'll be posting the recording, but thank you all for attending today. Really appreciate the questions.
Thank you so much. And make sure you start early. Don't wait. All right.
All right, thanks.
Bye-bye.